Hi, Karishma. I'm Saida Rizvi. I'll be your interviewer today. Would you want to start off with a brief introduction of yourself?
Yep. Hello, I'm Karishma. I recently completed my bachelor's in nursing, and I'm really excited for this opportunity.
Yep. For first question, no two shifts are ever the same for a registered nurse. Consider how you deal with stress on a busy shift and have many competing demands. What impacts your thoughts, emotions, and physical feelings have on your performance at work? What are your responsibilities as a registered nurse, and what strategies will you employ to ensure professional practice?
Yes, from my clinical placements and experience, I now know that in nursing there is no two shifts that are ever the same. Things can change quickly, and there are often a lot of competing demands. When I'm on a busy shift, I try to stay calm and organized. I start by prioritizing what's most important and communicate clearly with my team so we can all support each other. I've learned that asking for help or clarification when needed is really important, especially in a fast paced environment. I also pay attention to how I'm feeling mentally, physically, and emotionally because I know it can affect how I perform. If I'm feeling stressed or overwhelmed, I like to take a moment to pause, focus on my breathing, and ground myself. That helps me reset and stay focused. After a tough shift, I find it helpful to reflect, talk things through someone I trust without compromising any confidential information, and think about what I have learned. As a registered nurse, I know I have a responsibility to provide safe, person centered care, to advocate for my patients, and to also act professionally. I'm also committed to continuous learning and holding myself accountable to the NMBA standards of practice. I'll keep updating my knowledge, reflect regularly on my experiences, and seek guidance and feedback from my colleagues and mentors. I also believe that looking after my own well being, getting enough rest, and having a good support system and setting boundaries is key to being the best nurse I can be. As an example, during one of my clinical placements, several patients needed attention at the same time, and the shift became very stressful very quickly. I needed to help provide safe care, manage competing tasks, and support my team. I stayed calm and focused on what was most urgent. I let my buddy nurse know what I was doing, asked for help when needed, and work with the team and share tasks. When I felt stressed, I took a short moment to breathe, refocus so I could keep working effectively. The urgent needs were quickly met, the team worked well together, and my buddy nurse gave me positive feedback on how I handled the pressure. I also reflected afterwards on what I've learned for next time.
Great. So our second question is about mental health. Mental health is a significant and emerging issue within clinical facilities and the community. If the patient you're providing care for as a registered nurse experiences an episode of acute distress, what role do you think your position entails in ensuring the mental health of your patient you're providing care for?
As RNs, we play a vital role in supporting the mental health of patients in our care, especially if they're experiencing acute distress. First and foremost, I believe it's important to approach a situation with empathy, calmness, and non judgmental. I would aim to create a safe and supportive environment, listen actively, and validate how they're feeling. Often, just being present and showing someone that cares can make a big difference. I also know it's important to recognize the signs of escalating distress early. I would use my clinical judgment to assess the situation, ensure the patient is safe, and escalate appropriately if needed. Whether that's involving mental health clinicians, using de escalating strategies, or initiating a mental health review. At the same time, I'd respect a person's dignity and autonomy and involve them in decisions about their care as much as possible. Building trust is really important, especially in moments of emotional vulnerability. Overall, I see my role as not just responding to the immediate distress, but also advocating for the person, helping connect them to ongoing support and contributing to a compassionate, person centered culture that prioritizes both physical and mental well being. As for an example, where I currently work in an aged care facility, I was assisting a resident when they became very anxious and started crying, saying they felt overwhelmed and lonely. I needed to help calm the situation and ensure that they were safe and support their emotional well being. I spoke gently, sat with the residents, and encouraged them to share how they're feeling. I listened without interrupting, validating their emotions, and reassured them they were in a safe place. I then offered to contact a family member for a chat and let the RN know so we can monitor their mood and consider any further support. The resident became more settled, thanked me for listening, and later engaged in a group activity. This experience reinforced how important it is to be present and empathetic and proactive when supporting a patient's mental health.
Great. So our last question. How do the NSW Health core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse? And can you please provide an example from your clinical practice?
As a registered nurse, the New South Wales Health core values guide my daily practice by shaping how I interact with patients, families, and colleagues. Collaboration to me means working together with the healthcare team and patients to deliver safe and effective care. Openness involves being honest, transparent, and clear in my communication to build trust. Respect ensures I treat every individual with dignity, valuing their cultural beliefs and preferences. Empowerment is about supporting patients to actively participate in their care by providing information options and encouragement so they can make informed decisions about their own health. For example, during one of my clinical placements in a pediatric ward, I cared for a 5-year-old patient who was admitted with asthma. He was distressed and refusing the nebulizer treatment that was charted for him. Um, so the mother was also anxious and concerned that the treatment was being delayed. My role was to support the child emotionally, assist the RN with the treatment delivery, and maintain a calm environment. During on my own experiences as a mother, I approached the child with empathy, sat at their level, and engaged them in a conversation about their favorite cartoon characters. I also used play-based distraction, demonstrating the nebulizer on a teddy bear, and encouraged them to hold the mask when they felt ready. I kept the RN updated and reassured the mother, involving her in comforting her child during the treatment. With time and reassurance, the child tolerated and completed the nebulizer, and the mother felt more supported and involved. This experience highlighted the importance of collaboration between staff and family to improve care delivery, respect for the child's emotional needs, and the value of openness and clear communication. With the patient to build trust and how we could empower the child by allowing them to participate at their own pace.
Thank you so much, Karishma.
Thank you.